Hello, please come on in. I'm Dr. Eclipse, and today I'm gonna perform your cranial nerve exam. First, I'd like to ask you, how have you been feeling recently? And are there any issues that I need to know about? Alright, so have you had any injuries lately? Okay, got it. Any complaints? How do you feel when you get up in the morning? Do you ever have any flickers or flashes in your eyes? Any dizziness? Okay, wonderful. Have you had any headaches lately? Got it. Okay, amazing. So, we're gonna start our cranial nerve exam with testing your olfactory nerve, which actually controls your sense of smell. So, first, I'd like you to actually help me test your breathing. And could you please breathe in deeply? Yeah, just inhale deeply. Okay, wonderful. Good. So now, could you please close one of your nostrils and do the same? Yeah, like that. Okay. Good. And now the other one. Okay, wonderful. Good. And now let's test the sense of smell itself. I'm gonna spray some of the tester and I'm gonna let you smell it. Let's do it with one nostril first. So could you please close one of the nostrils and smell it? Okay, wonderful. Yep, means it is. Great job, amazing. And now the other one. Please close the other nostril and let's try to test it again. So, okay, what now? Yep, citrus it is. Okay, amazing. So the olfactory nerve works just fine as it should. Amazing. That's really great. Give me a second. I'm gonna take some notes. Really basic ones. So, alright. And after we've tested the olfactory nerve, I like to test your optic nerve, so to test your vision. And let's start with a very basic chart. Okay, so again, there's nothing really special about it. I'm pretty sure you've seen it many times before, but let's test your vision a little bit. So could you please tell me what symbol can you see there? Okay, good. So yeah, this is pretty simple relatively because they are quite large. Okay, let's proceed further. What about this one? What letter is it? D, right? Yeah, amazing. Okay, what about this one? Okay, amazing. Good. Now let's make it a little bit more challenging for you. What about this letter? Excellent. Okay, and this? Okay, great. What about this? Alright, and could you please try to read this line? I mean the last but one. Okay, good. Alright, that's really excellent. Good. So, and now let's test your vision a little bit more in detail. So I'd like you to close one of your eyes. Yeah, it's better if you do it yourself. So, could you please keep it? Alright, good. So, you know what to do. Let's start with the right eye. And let's take this test. So I'm gonna ask you to tell me if you can see what is depicted there in the circle. Can you see anything? Okay. Okay, good. Yep, right, yeah. So what about the circle? Can you see any figures, any shapes there? Okay. Okay, excellent. Now please cover the other eye. Yeah, exactly like that. Okay. Okay. Good. So could you please tell me if you can see anything there in the circle? Okay. Okay, great. How about this one? Alright. Amazing. And this? Excellent. Doing good. So now, please keep your eye covered and let's test your vision a little bit more. So now I'd like to see how well your oculomotor nerve works. Okay, so please follow the light for me. Okay. Good. That's great. Wonderful. And now cover the other eye, please. And please keep on following the light. Okay. Okay, good. Amazing. And now, yeah, you can take it down. No need to cover your eyes. And now, could you please have a look at my nose and let me know when you see my fingers wiggling, okay? But please look at me, look at my face. You can concentrate on my nose, and I'd like to test your sight vision. So just tell me when you see my fingers wiggle, okay? Good. Okay, amazing. Good. Now please tell me which side are they wiggling on. It can be right, left, maybe both. Okay. Okay. Good. You're doing great. Now please keep on focusing on my nose and let me know when my hands actually leave your vision. Okay? Good. Amazing. Okay. Please keep looking at my nose. Good. Good. Great. Okay, wonderful. Okay, amazing. So now, please look at the light, concentrate on the light, and tell me how many fingers I'm holding up. Okay, good. Okay, wonderful. Good. Excellent. Okay, marvelous. Wonderful. Now please concentrate on my nose again. And again, tell me how many fingers I'm holding up, okay? Okay, good. Good. Great. Wonderful. Okay, marvelous. Okay, amazing. You're doing great. Let's test your trigeminal nerve. That would be your sensitivity test, in other words. And first, please close your eyes and let me know when you feel that the hammer touches your skin. Okay, when you can feel the hammer on your skin. Okay, okay, wonderful. Yep. So you can straighten your arms. Okay. Can you feel it? Alright, amazing. Yeah, simply let me know when you feel. Okay. Okay, good. Good. Wonderful. Yeah, that's great. So now the hammer has two sides, as you can see, the one that is softer, the red one, and the other one, metallic, that is quite sharp. Okay, so I'd like you to try to actually tell me which side of the hammer I am touching you. So you will need to differentiate between the soft and the sharp side and the feelings they can produce. So in this case, please close your eyes again, because it only makes sense with your eyes closed. And in this case, you won't be able to anticipate which side I'm gonna use, so we'll be able to test basically the trigeminal nerve really well. Alright, so are you ready? So just tell me if it's soft like a doll or if it's sharp. Okay, okay, wonderful. So let's start. Okay, so that was soft. Okay, amazing. Good. What about now? Alright, good. So that was this sharper side. Okay, wonderful. Now let's try it again on the other side. Okay, good. So that was sharp right here. And what about now? Yep, that was soft side, dull side. Okay, good. And now, could you please tell me when you feel this brush on your skin, and let me know where exactly it is. So please straighten your arms, your hands for me. Okay, good. So, okay, which side it is? Good. So where exactly is the brush? On your finger, right? Okay, and where exactly is it? Is it closer to your nails, to your wrist? Okay, good. Which finger is that? Right, yeah, okay, amazing. What about this side? Okay, that's your wrist. Right, yeah, good. What about now? Okay, okay, good, amazing. So the sensitivity seems to be really, really good. And then the next thing I'm gonna test would be actually your knee-jerk reflex and some other reflexes using this hammer. So I guess that you are probably familiar with the procedure, like how it all happens, so please just relax. It's not gonna hurt, it's not gonna be really scary, so there is nothing to be afraid of. So let's start with your wrists. Okay, good. Okay, amazing, wonderful. Now I need you to bend your legs. Yeah, right there. Exactly. Could you please put one leg over the other so that your foot stays clear of the floor? Yeah, exactly like that. Simply bend your knees and yeah, amazing. Okay, so let's test your knee jerk reflex. Okay. Good. Okay, wonderful. Now the favorite part of many of our patients. I'd like you to make some faces for me. So this way we'll test your facial nerves. Could you please frown eyebrows? Yeah, let's just imagine you are mad at me for some reason. Okay, yeah, like that. Okay, wonderful, amazing. Now could you please raise your eyebrows like as if you are really, really surprised or shocked? Good, wonderful. So could you please smile for me? Alright, and show your teeth like that. Okay, wonderful. Please puff your cheeks. Okay, let me check how strong it is. Now let me close them. Okay, amazing. Good, wonderful. And now, could you please clench your eyes really, really, really tightly? Now let me open them. Good, amazing. Okay, so all the muscles, all the nerves work really, really well. So, and now right away let's check the accessory nerve, the muscles of your neck and of your shoulders. So could you please shrug your shoulders for me? Alright, good, wonderful, thank you. So now the next one, a really important part of the cranial nerve exam would be what we usually call the hearing test. Yeah, so in this case we actually test not just your hearing but also your balance and stuff. Yeah, so in this case that would be your vestibulocochlear nerve. And so we test both the hearing and the balance, your ability to balance, which is also quite important. So what I want you to do, let's start with the really, really simple stuff. So I will tell you some words. I will do it really, really quietly, and I will also try to produce some extra noise as some kind of a distraction for you, and this way we'll be able to actually test your hearing abilities. So just let me know what you hear, okay? Yeah, which word you heard. Okay, wonderful. So the first one will be butterscotch. Okay, good, wonderful. And the other one will be lantern. amazing. Now, back rub. Good, amazing. And now, stethoscope. Okay, good. So, now the other thing, next one. Tuning fork. Again, I'm pretty sure that you're quite familiar with it. So, this thing is gonna help us test both your balance and your hearing. So, first, I will put it behind your ears, and then I will put it a little bit closer to the ear itself, to the ear canal, and you are actually gonna tell me when you can't feel the vibration or hear the sound anymore, okay? Good. So, are you ready? Let's do it. Okay, good. So now the other ear. Okay, good. So, and now I'm gonna put it onto your forehead, and the same way you will pay attention to how well you can feel it and hear it on both sides. Yeah? So I'll put it symmetrically in the center, and you will simply let me know when you actually like stop hearing the sound again. Good. Okay, amazing. So, did you feel the vibration and did you hear the sound symmetrically on both sides? Okay, that's amazing. Good job. And now, as for the balance, could you please straighten both of your arms? Okay, amazing. Good. And I want you to close your eyes and touch the tip of your nose. Yeah, just reach the tip of your nose with the index finger on both of your hands. Yeah, like one by one. So let's start with your right hand. Okay, just close your eyes, relax, and touch. Reach the tip of your nose with your index finger. Good. Okay, wonderful. And now with the other hand, the same index finger. Good. Okay, good. Amazing. Wonderful. So now let me inspect your mouth and your tongue, your throat a little bit. So would you please relax your jaw and open your mouth a little bit. So I'm gonna use the spatula and press on your tongue really gently, so no worries. Okay, and I'm gonna use the light to see if everything is alright there. Okay, so please let me have a look at it. No worries. Okay. Yeah, like that. Okay, good. Amazing. Okay, wonderful. And now, could you please stick out your tongue again? Alright. Let me have a closer look at it one more time. Alright, so now could you please move your tongue from side to the other one? Okay, from side to side. Yes, right, you're amazing. And now you can close your mouth and please try to move the tongue inside your mouth cavity. Okay, just like that. Okay, amazing. Good. So, and now one more thing. Could you please cough for me? And now swallow. Good. Wow, I'm really happy with all the results we've got. All your cranial. Oh, hello. How are you feeling today? I'm glad to see you at our clinic. Could you please tell me a little bit more about the way you feel? And I'm particularly interested in your hearing, obviously. Do you have any complaints regarding your hearing? Okay. Yeah, I get it. It's quite common. What about any kind of earache or discomfort in your ear, or any kind of pain in your ear canal or wherever else around your ears? Yeah. Okay. I understand. No worries. We'll handle that, whatever it is. And how long has it been? How long have you had this condition so far? Yeah. Okay. Okay. It's actually good that you decided to come right away. Yeah, to make an appointment with a doctor right away. It's a really good thing. It's very responsible of you. We respect that. Yes. I mean, nowadays many patients are quite irresponsible and careless when it comes to their health, and it's really good that you came right away, and now we can handle the situation. And yeah, it's really good. Of course, yeah, until it's too late, sure. Well, let me touch your ears really gently, okay? I simply need to see if everything is alright, at least with the outer ear, okay? Good. So just relax. It's not gonna hurt, I promise. But just in case, if you feel any kind of discomfort caused by this checkup, just let me know, okay? Just at once, right away. I need to know that, okay? Good, so that I can stop if you feel any kind of pain or ache or whatever it is. Deal? Good. So. Wow, so far your ears look really nice to me. I don't see any troubles, at least for now. Okay, let me have a closer look to both of your ears. Good, and now one more time. Okay, well, I guess that would make sense to have a closer look using an otoscope. Okay, again, it's not gonna hurt, but in case it does, you let me know. Okay. Just a second. Just relax. All right. And now this one. Okay. Well, I have some guesses what can cause the this kind of discomfort and troubles with your hearing, but just to be sure, I'd like to just do this short hearing test, okay? I guess you won't mind it. It's gonna be fun, I promise. Right, tuning fork. I'm not sure if you know how it works, so I'll explain it to you. Well, I'm gonna make a sound using this tuning fork, and yeah, it will be the sound at some certain frequency, and you will let me know when you can't hear the sound anymore, okay? I'll put this tuning fork right behind your ear, okay? And you tell me when you stop hearing the sound, okay? Simple. Let's do it. Alright, and now let's try one more time. So now you can't hear it anymore. Okay, good. Well, that's really good. That's quite accurate. So, okay, it makes sense. So this thing is all right. And now, let me have some additional checkup just using this mirror. Okay. Okay, thank you. So I might touch your ear really gently, but I'm sure it's gonna be alright. So I hope my hands aren't too cold. But in case they are, I'm sorry in advance, okay? Well, so just let me see. Let me have a look. Okay, good. Yeah, that's actually what I thought. And the other one, pretty much the same. Okay. Well, basically, I have really tiny wax buildups in your ears, both of your ear canals. It's nothing really serious or something. It's not like something you should worry about. It is quite common, to be honest, and like many people face it. Many patients face such trouble, such I don't know, like condition. I would call it just condition. So it's not like some kind of sickness or something. So just no worries about that. Well, what it can be caused by, I would say that some people just naturally have this kind of like thicker earwax of thicker consistency, which causes this kind of like buildups. And for some people it can be caused by, you know, like using earplugs too often or something like that. Yeah, so basically it would be really cool if you minimize all the risks. Like I would say that you have to, like, you should refuse from earplugs for some time, like earphones, earplugs. Yeah, it's not the best idea to use them now, but in general, sometimes it just happens, you know, so it's not a big deal, I promise. Well, I guess that what I would suggest to do is some really brief ear cleaning. We'll just clean your ear canal a little bit, you know, and basically help you get rid of those buildups, you know. So there's nothing really complicated about this kind of treatment, and I guess that we should start right now. Yeah, if you're ready, of course. Are you? Okay, well, let's start with these special ear drops that I have. It's not even like ear drops, I would call it some like special liquid that's gonna help to soften up this earwax, and later I will be able to kind of like scratch it out of your ear canal. Let's call it this way. Okay. Well, please don't be scared by this syringe and its size. It's just really convenient to use it this way, but there's nothing really really scary about it, I promise, so it's gonna be fine. Well, I just add up some liquid in your ear, yeah, one by one, and then we'll wait a tiny little bit, and later I will just clean them. Okay, makes sense, right? It's not really that hard, I promise, and it's not gonna hurt. It shouldn't, but again, if it does, you let me know. Okay, please don't hesitate to tell me. There's nothing wrong about like telling me if something goes wrong. Okay, so I suppose you can probably hear some sizzling sound. Am I right? Yeah, that's just the way it works. Oh, I hope it's not too bad. I hope it's not too loud. Okay. Good. Good. Shall we add some more? What do you think? How does it feel? Well, since it's not pouring out of your ear anymore, I think we could add some more liquid. Okay, let's do it. Ooh. Just like that. Okay, good. How does it feel? Can you hear this sound again? No, it's totally fine. That's the way it's supposed to be. So just relax, relax, relax and try to enjoy it. While you have no other choice anyway. Good. Okay, let me see what it looks like, okay? Yeah, well, let's give it some time to actually do its job, okay? Soften up the earwax, and now I guess we can skip to the other ear. Alright, as you've seen, there's nothing really scary about it, so please just relax, okay? Relax, it's gonna be fine. I'm not gonna hurt you, I promise. A little bit more. Okay. Okay, fine. How does it feel? Again, this is Lynn. Well, that's just the way it works. But I guess it's not really unpleasant or something, right? You know what? Let's add a little bit more. Okay. Oops. Good. Fine. Let's give it some time, okay? Let me check it with my hand, okay? Okay. Great. How does it feel? Good. Well, I see that you're quite relaxed now, which is really great, since now we're gonna start the actual cleaning. Well, so just please try to relax, and I'll use my mirror to see what's going on, and this tiny brush. Okay. So no worries about that. Fine. Okay, very good. Okay, just a second. All right, now let's proceed with the other one. I'll just do it, we'll take turns. First one ear, then the next one, the other one, and okay, this one seems to have a bigger build-up, so I'll just make a little bit more effort to make sure we get rid of it. Well, I guess it's enough with a brush, and maybe I should use some cotton buds as well, okay? Good. So, let me do it. Okay, just give me a moment. Just a little bit more of this liquid, because I guess it's not enough. Okay, now it's much better. Good. Alright. And just a little bit more on this other side, okay? Good, good. Alright, let me just massage your ears a little bit, okay? This one. No worries. It's gonna feel alright. Yeah. Just wanna get rid of this excessive liquid and of this earwax as well, okay? So just let me do it, it's fine. It's not gonna be painful or something. Alright. Well, looks much better now. You know, I guess that now it's time for this other kind of eardrops. They will just help us to get rid of these remains, because there's no much earwax in your ears anymore, but just want to make sure. Not much. So just a second. Good. And now the other ear. Good. Well, let's wait a few seconds till it works, alright? And while we're waiting, I guess that I could have a closer look at your ear canals one more time, okay? If you don't mind, of course. Sure you don't. Good. And the other one. Okay, now that's basically what I wanted to see. They're completely clean, and we removed all this excessive earwax, so no more build-ups and stuff like that. So, how can you hear me now? What about this feeling of discomfort and slight earache? Is it gone? Okay. I put this cotton buds into your ears, and you will take them out once you get home, okay? Good. So we put in this one. Okay. And now this one. Okay. Good. Well, you're free to go now. Thank you for making this appointment. It's really, really important that you actually did it and decided not to wait till it becomes like way too painful to handle it. And then I guess that I would just recommend you to do such checkups from time to time. It wouldn't hurt, that's for sure, and like hearing tests as well. Okay? Right. Thank you too. Have a nice one. See you soon. Bye.